Hi, I am Sister Mulepo at TUT South Campus. I'm going to give you a brief overview on COVID-19. Our main objectives. We will be looking at the prevention and control measures, how you can prevent yourself from getting this COVID-19. And we're going to look at the signs and symptoms, how to identify these signs and symptoms, and how to go about when you're having these signs and symptoms. That is, we're going to refer you to a specific place where you're going to get help. What is COVID-19? The first CO, it stands for corona. It is the crown-like. So the virus is in a shape of a crown. And the V, it stands for the virus itself. And the D, it stands for the disease. The 19 at the end, it stands for the year that this virus was identified. What is COVID-19? COVID-19 is a respiratory illness, meaning it will attack your lungs. It will attack from your nostrils, and then it will move down until it reaches your lungs and give you symptoms like pneumonia. And it is highly contagious, more than the flu virus that we normally know. It's also called SARS-CoV-2. We've got few terminologies that you need to know. The first one being community spread. We have occasions whereby the virus will spread within a certain community, like the measles. It was spreading only around a certain geographical area. We have social distancing. This is when you keep yourself away from another person for more than 2 meters because of the way the droplet will spread. It can only spread within a meter in the air. So if you are a 2-meter distance, then you are safe. We've got congregate settings. This is places like when you are in a place where there's a lot of people, like the malls, the funerals, the weddings. These are the places that you need to stay away from. We've got incubation period. This is the period whereby the virus is in your body, but it's not yet showing the signs and symptoms. It can be 2 to 10 days, differs from person to person. We've got isolation. Isolation is when you keep yourself away from the other people because probably you've been in contact with the person who has been having the virus, or you are showing few symptoms and then you don't want the other person to contract the symptoms. We've got quarantine. Quarantine, it's when you have tested positive for COVID-19 and you are also a contact. This is the place normally from the Department of Health. They will make a place for you whereby you will be taken care of, and then you are far from anyone. You are in your separate room whereby you get your treatment there, or even if you're not showing the symptoms, but you are placed in that area for 8 days or even 10 days. Epidemic. This is when the virus has spread throughout the whole lot of geographical area, and it's continuously spreading. It's epidemic. Pandemic, it's whereby now this virus is spreading throughout the whole world, and now it's pandemic because it's affecting every place.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
The symptoms of COVID-19. They include the fever that is above 37.5. If you have the fever from 37.5 upwards, go seek medical help. And the headache as well. The dry cough, which is persistent. Tiredness, when your whole body feels tired. General body ache, you just feel pains and ache all over the body. And the sore throat. The shortness of breath, when you're really feeling out of breath. And the loss of smell. This is when you don't smell anything, even the perfume that you normally know. Loss of taste. The food is not tasting anything. The abdominal pains, the diarrhea, and the vomiting. How long does COVID-19 last on surfaces? On the surgical glove, it lasts for 8 hours. On the plastic materials, it lasts for 5 days. On the paper, it lasts for 4 to 5 days. On the glass, it lasts for 4 days. On the wood, it lasts for 4 days. The steel, it lasts for 48 hours. Aluminium, it lasts for 2 to 8 hours. The clothes, it lasts for 8 hours. Here are the prevention precautions that you must adhere to. Wearing of face mask. It should be a 3-layered face mask. And the hand wash for 20 seconds with soap and warm water. If you don't have soap and water, you can use hand sanitizer, which is 70% based on alcohol. And social distancing for about 2 meters. No physical contact, no hugging a friend, no holding hands with friends. And then when you cough, cough into your elbow or cough into a tissue and throw it in the bin. No exchange of any items like pens in class or sharing cell phones in class. Self-isolation. When you have the symptoms of COVID-19, that's when you have to self-isolate. It means to be alone in the room. If there's somebody who needs to bring you food, they need to put it outside the door. And you must also seek medical help. Wearing a face mask. You should wear a clean face mask daily. Make sure that your hands are clean when you put on your mask. You must cover your nose and your mouth because it is pointless to leave your nose outside the mask as you're gonna get the contaminated air into your nostrils. Make sure that it fits against the side of your face. You need to breathe easily, so the face mask must not be too tight on your nose. Store your mask in a pocket or a bag when you are eating. Don't put the mask around your neck or your forehead. Don't touch the face mask. Removing a face mask. You can only remove your face mask when you are not in public places. You can untie the strings behind your head or stretch the ear loops. You can only handle by the ear loops or the ties, not handle the mask itself. You can fold the corners together and place the mask in a plastic bag. Don't touch your eyes, nose, or mouth. Wash your hands immediately after removing your mask. Washing your face mask. You can wash it with your regular laundry. You can put the laundry detergent like Jig, and the water should be warm. You should hang it outside in the direct sunlight for it to dry. You can iron your mask if the material allows it. The best management we have at the moment is maintaining a healthy lifestyle. By eating a well-balanced diet, your fruits, your vegetables, by exercising regularly, by drinking 8 glasses of water per day, by avoiding unnecessary stressors, as this can reduce your immune system. The new normal. We have to adapt to this new normal. Presenting a health check app results every morning when you enter the campus, which is valid for 24 hours. Make sure that you're wearing your face mask when you enter the campus and you have closed both your nose and your mouth. Sanitize your hands regularly at the entrances. Keep 2-meter distance away from the other students while in your lecture rooms or anywhere else. Here is the screening tool that you must use. You can download the Health Check app from www.healthcheck.higherhealth.ac.za, or you can send a WhatsApp to 0600 11 0000 and type the word hi, or you can use the USSD by dialing *134 *832 *2# and follow the commands. Here is the referral system that we are using. If you present with signs and symptoms of COVID-19 and you have been in contact with a positive case, we refer you for testing at the local clinic, that is at Maria Ranto or Clinic 2 in Block G. In other campuses, there are clinics that are around them. If the signs and symptoms are acute, we refer you to our local hospital. If the results come out positive, we will refer you to an identified quarantine site. These are the websites that you can find more information on: the NIOH, the NICD, the Department of Health website, the SA Coronavirus website, and the World Health Organization, and the Higher Health website. Thank you. Please adhere to all the regulations and be safe.